Ya regresamos a Domingo Live. We're going to talk about diabetes, because we always do in this segment and have been for the last couple of years, right, Barbie? We got Rick Bentley.
Hey.
Why do I keep calling you Rick Bentley? You know, Rick, I'm sorry, but you know
No
what?
problem.
The name is so close to someone who I know. But let's talk about the most important thing is that you're here, and that you're here to talk about a topic that is so important when it deals with diabetes, and that's false hope. There are people out there who talk about cures, about being able to rid you of diabetes.
Right. Well, not only diabetes, but any other chronic disease and acute diseases as well. There's all kinds of false hopes out there. And when we talk about be safe from diabetes, it's not just a catchy slogan. You need to take it very seriously, because diabetes is a very serious disease, as is so many others. And when people try to take money from someone to try an alternative type therapy and tell them to stop taking their medication from their doctor, it's very, very serious.
You can't do that.
No, I
It
know
could take your life.
I know a lady who was diagnosed with breast cancer a couple of years ago. And of course, that's a hard thing to face, surgery and follow up with chemotherapy. Who wouldn't want to face that, of course? Well, she chose alternative therapy, and today she has cancer in her bones, her kidneys, and her liver. Now think about how much better her prognosis would have been if she would have sucked it up and done what she was supposed to have done when she was
Followed
diagnosed.
the doctor's orders and recommendations.
Right.
And we're talking about scammers. We're talking about people that give false hopes to people. Estamos hablando de chantaje, cómo alguien te lo puede chantajear y decirle que hay otros medicamentos que pueden tomar la parte de la insulina, for instance, right, in place of the insulin.
Yeah.
They're telling. I'm explaining in Spanish how there's a lot of scammers out there.
Right.
They're going to talk to you about other medications that they can take instead of their insulin.
Well, actually, not even other medications. They're trying to get them to buy their supplementation. Now, supplements can be a good thing. I don't want to discount that. I mean, but people need to realize supplementation is exactly that: supplement nutrition, not cure
replacement.
disease. In fact, this guy right here is the king of all scammers. You may have seen this guy
We
on
have
late night.
seen that guy
Yes.
many times.
Yes, the reason I bring this is because this book is a multi-million-dollar seller,
Yes,
which
it is.
tells me that a lot of people are buying his scam. And what he does is he tells people that there's this big conspiracy to get you off or to keep you on medication to keep you sick, and you need to try his way, which is immediately stop all medication. So people buy into that. Oh, that sounds, yeah, I could see how the pharmaceuticals are wanting me to stay sick and stay taking them. It's a scam. And people need to really think about what they're going to do. If they want to try alternative therapy, they can do that in addition to maybe what they're taking, but be sure and tell your doctor what you're doing. You want to make sure there's nothing contraindicated between a supplement and a prescription medication.
I mean, but you can't help folks, but you can't blame them for thinking that maybe this may work.
Right.
For thinking
Because they're just
this
reaching
may
out
be
to anything.
Exactly.
Right.
You can't blame them.
It's not fun for me to have to take insulin every day the way I do and stick my fingers and face all the things. Of course, I would love to have a quick fix, but I know that it's not there, and my health is the last thing I want to gamble with.
Yeah.
I'm one to step out of the box and try something new.
Sure.
And a lot of things in life, but I don't gamble with my health, and neither should anybody else. Be sure and follow your doctor's orders, and if you don't think your doctor is aggressive enough, maybe try another doctor. But don't make the mistake of bouncing from doctor to doctor trying to find one that'll tell you what you want to hear.
Exactly.
Don't do that.
Exactly.
Generally, the one that sits you down is the most frank with you. That's probably a good doctor.
I mean, do your homework. You have to study. You have to understand what it is that you're dealing with when you have diabetes, how complicated it can be,
Right.
and yet how you can control it, how you can do well, how you can continue to have a normal life. I mean, look at you. You're the
I'm
epitome
living
of
proof
health.
of it.
Absolutely.
I got good early diagnosis. That's also very important. That's one thing we talk about in Be Safe from Diabetes. Early diagnosis starts your treatment earlier. So you don't want to avoid that treatment, whether it be a long-term disease like diabetes or a deadly killer like cancer. Whatever the doctor says, you better start right away.
And in our culture, we practice a lot of home remedies. And so it's difficult for our people to not to believe these things because they are reaching out there for false hope. But when it comes to something like diabetes, you can't play around with that stuff. You have to listen to your doctor. Necesitan escuchar a su doctor y los medicamentos que él le dice y no anden escuchando a otra gente que a lo mejor ni sabe lo que están hablando.
Así es.
And in diabetes, getting away from medication, you don't really see the immediate effects like you do with some other type of disease like cancer. But know that your body's being damaged long term. You will be ending your life sooner if you stop treatment and get off that. Now, it's possible to to do good exercise and proper nutrition, lose the weight, and eventually get off the medication. But make sure it's your doctor's is the one who's weaning you off of it.
Sure, that he,
Not
it
some,
comes
not
from
some
doctor's
witch,
orders.
Not some witch doctor.
Okay. Rick Haley, thank you so much for being with us. You're with the Diabetes Council, Texas Diabetes Council, and we love having you here because you always
thanks.
bring us some interesting stuff that folks at home, you have to sit back and chew on a little bit.
Right.
You kind of know where we're going with this.
And
Okay.
you've lived it, and you're living it. So that's there you go.
Thank you so much. For
Thanks for
being
being
Thank
here.
you.
Okay, very good.